Apart from these 3 vaccines which are given at 1.5, 2.5 and 3.5 months, there are 2 additional vaccines. One is the rotaviral vaccine for diarrhea and the pneumococcal vaccine, the commonly called as the pneumonia vaccine. Now these 2 vaccines are given compulsorily and is on the immunization schedule in most parts of the world. In our country, it is still to reach the immunization schedule as given by the government, and these vaccines are available in the private sector for those who can afford and who can give it to their children. I would recommend that all those who can give this vaccine should give it to their children. We also have other vaccines which are given at 9 months, which is measles. We have another vaccine at the age of around 15 months, which is the MMR, which is a booster for measles, German measles and mumps. Chickenpox vaccine, which also comes in the additional vaccine category, where patients who wish to take it should definitely take this vaccine. This again is not available in the government sector. Then comes the time of boosters. So at 1.5 years, the vaccines which were given at 1.5, 2.5 and 3.5 months, a booster dose of that vaccine is given to enhance the immunity for the child. 2 other vaccines enter the immunization schedule at this time. One is the hepatitis A vaccine, which is for the common jaundice. Again, an additional vaccine given only in the private sector, a good vaccine with very good efficacy. Typhoid vaccine given at age 2 years, which is I think a must take. Still not on the government schedule, but slowly and steadily these vaccines will definitely come on the government schedule. But typhoid vaccine I would strongly recommend, a not very expensive vaccine, but necessary to give it to all children because this disease can be quite crippling for the child and would land up getting the child to be admitted in a hospital. The next booster comes at around 4.5, which is again for the primary vaccines which are taken in the first year of life. There are a few additional vaccines like the cervical cancer vaccine. Also we have the flu vaccine, which again can be discussed on one-to-one with the patient, and if the patient desires to take it, these vaccines can also be taken. So the list is ever growing, but it also means that your child is getting protected against very many diseases and is going to lead a healthy life. What also bothers the parent is, are there any adverse effects to these vaccines? Most vaccines are very safe and hardly ever cause any adverse effects. At worst, they would cause a little pain, induration or redness at the site of injection, mild fever for a day or 2. And these symptoms can be easily managed by simple use of paracetamol. So my dear patients, I would say that you must take advantage of all the vaccinations that are available today and protect your children against as many diseases as possible.